that now we have to live with. Okay, now it's, yeah, I think the more the numbers are increasing, we are getting more comfortable, which is dangerous. It's very dangerous that like we're getting more comfortable in whatever, like trying now to find ways of how to live with it. But then sometimes our ways of living with it, they can be slightly dangerous, if I would put it in that way.
And on the other hand, we've been missing our daily routines.
Hello, O team, and welcome to Doing, Being, Becoming, the podcast, a platform where we aim to inform, impact, influence, and inspire. I am your host, Asisipo Tota, an occupational therapist, and maybe this isn't your first time hearing my voice. Maybe you're familiar with my voice, my face, and the name Doing, Being, Becoming from our YouTube channel. But if you're hearing about this for the first time, Doing, Being, Becoming is a channel where we aim to bring you to a greater awareness of occupational therapy as a profession and also alert you to how you can benefit from it. Though not limited to, we specialize within the field of mental health and as a result seek to bring our viewers to a greater awareness of themselves and sensitize them to issues pertaining to mental health in general and, where possible, their own mental health. So, if this sounds interesting to you or you want to explore the depths of your mental health a bit further, feel free to visit our YouTube page and connect with us on our social media platforms. We would love to hear from you. But for now, you can stick around. In today's podcast, we will be touching base with the human experience of COVID 19 in South Africa, breathing life into the stats and hard facts through real voices and lived experiences. I will also try, with your assistance of course, to predict the future of South Africa post COVID using the information made available to us at this point in time. How can you assist? By joining in the conversation below. So it's basically impossible for anybody not to be aware of the situation that the world is in right now. I'm sure even newborn babies are born with a starter pack of sanitizer in one hand and fitted for masks for their preeny little faces, and their first few words are social distancing. Although infection rates may vary from country to country, the entire globe cannot find itself without or outside of the effects of the COVID 19 pandemic. This has affected our health systems, education system, justice system, global industries, and the economy at large. Each sector can be dissected individually, but I think at the root of all of this is the machinery required to steer any of these ships forward, and that is the mind. As a collective, as corporates, as communities, families, as individuals, how are we doing? Do we even dare ask ourselves that question?
No! Oh, don't cry, are you?
In addition to that, how are our thoughts, perceptions, practices, habits, and strategies changing to meet the demands and new culture being shaped by the lockdown? Let's take a look at that word, lockdown. What does it imply? What does it come with? Just the word itself triggers thoughts of confinement, iron bars, cold walls, isolation, and bland meals. And I suppose that picture aligns with the traditional definition of the word, which defines a lockdown as the confinement of prisoners to their cells, especially to regain order and control after a riot or brawl. But given the context we find ourselves in today, it is understood by the majority that the restricted access to resources and facilities is to protect the lives of people, for security, and more fitting, for health reasons. In the case of South Africa, As stated many times by our president, the lockdown aimed not to prevent the spread of the virus, but rather to slow down the rate of infection and, while so doing, prepare the health system for the burden that would come with treating those infected with the coronavirus disease. The initial 21-day lockdown, announced to start in South Africa on the 26th of March, involved staying at home unless to perform an essential service, to get an essential good, or to receive an essential service, or to grant or seek emergency medical services. In addition to this, the country's borders were closed for business and for leisure, and travel within the country was also prohibited. Speaking of prohibitions, who could forget the alcohol and cigarette bans that still have the whole country of suppliers and consumers in an uproar? I believe many will agree with me when I say this, and maybe you will too, that though the lockdown meant to safeguard the nation, if anything, it just emphasized how unmet the needs of the South African majority are. Looking at it from an occupational science point of view, occupational injustice has never been clearer than it is now since the inception of the country's democracy.
At the beginning, it came as a shock. I don't want to lie. It came as a shock. I was in disbelief. Like, I couldn't believe that it's a reality.
Occupational deprivation is the exclusion of people from participating in meaningful activities as a result of factors outside of their control. We can all agree that with the great plans and anticipations we all had for 2020, a novel virus that would freeze the whole planet was never a part of the plan or our imaginations. The forever skyrocketing rise in new cases of infections in South Africa also increased the risk of burnout on essential health staff, and the new demand and pressure placed on hospital staff can alter the meaning one derives from the occupation they participate in. Ironically, for Onitha, it was the opposite. Onitha, whom you heard in the voice note, is a physiotherapist at a public hospital in the rural Eastern Cape. She accounts that though she was showing up for work every single day, nothing had changed there. The conditions surrounding her work had changed in that now she was seeing less patients, and as a result, this shifted the meaning she attained from that occupation. Looking to industries, for factors outside of their control, some industries were forced to re-evaluate how they operate and send employees to work remotely from home. However, what about the 63% of South Africans who aren't essential workers and are neither able to work from home? These are the individuals who stand the greatest risk of losing their jobs and possibly being subjected to poverty during or after the lockdown. I mean, we've all seen several industries retrenching staff and announcing pay cuts. Many South Africans, especially during level 5 of the lockdown and some even now, continue to be deprived of the activities relating to providing for their families, a threat to the basic instinct to live and to have valuable activities form part of their self esteem and identity. Occupational alienation is a sense of isolation, powerlessness, and loss of self as a result of engaging in occupations that do not satisfy your inner needs. Management of the coronavirus disease finds itself in a difficult spot where, to reduce the rapid and hazardous spread of the virus, those testing positive for the disease need to be isolated while they recover. Ironically, though, it has been found that self-isolation can be twice as harmful to your physical and mental health as obesity. Hout Lundstedt commented on this, saying, and I quote, "There is robust evidence that social isolation and loneliness significantly increase risk of premature mortality, and the magnitude of the risk far exceeds that of many leading health indicators." End quote. So, what's the cause of death then? Is it COVID or loneliness? To that effect, I say, my fellow South Africans, check up on your loved ones, check up on your friends, your colleagues, your neighbors. Not only should we boost our immune systems by taking supplements and practicing the precautions, but we need to keep the social cohesion intact despite the physical distance. As South Africans, we need to break the stigma surrounding this viral disease that pushes people to the dark corners of their rooms to cough into the nothingness. Instead, we should understand the healing power in being intentional with placing a call or including each other in meaningful activities in a safe way. This just highlights to us that we are indeed social beings, and no attention to a viral infection will silence that human need. Now, more than ever, support should be given to those fighting this disease in order to increase the chances of recovery, offering holistic treatment. As we can see, this is a highly complex situation affecting everyone and everything in all spheres. But the prominent question we want answers to today is, how is our mental health affected by COVID 19 and the lockdown?
Mentally, the pandemic and the situation that you're currently in has changed the way that I think about myself, the way that I think about the environment that I'm in. I've started to appreciate little things because I noticed that those little things can be taken away by something like a virus. So from sports to bars and everything. So I've learned to appreciate more things in life, and I've learned to take the opportunities that I get with both hands, I guess. Um, Post this pandemic, I don't think life is gonna be the same, especially according to live events, sports events, and so on. I think starting from now, people are gonna look for better ways in order to do live shows and performances for health, in order to protect our health. Hygiene is going to be a crucial and large part of our lives. It has also changed the types of occupations that people will start looking for now, because um, people notice that you can do remote working, you don't need an office, you don't need to go to work every day. So it has changed the routine that people normally take. It has brought in new system and mechanics to our lives. It has really literally flipped our lives upside down. So there's new ways to do things, there's new ways to play sport, there's new ways to have fun, there's new ways to actually work. And it has also shown us that how important nurses and psychologists and therapists actually are, because now we've noticed that a doctor is nothing without his or her nurses.
That was Sinalo Vapi answering the question of the effects of the lockdown on his personal mental health and what this time has taught him, and also what he anticipates for the future of South Africa. Thank you so much, Sinalo, for that. Let's piggyback off of that, of what you said, and actually explore what a possible South Africa looks like post lockdown, post COVID 19. I love the positive outlook you're able to maintain, Sinalo, seeing opportunity in this prolonged crisis. Dr. Miles Monroe once said that crisis is the source of creativity, and we have definitely seen that. As much as businesses have been suffering, others have been fortunate to both see and seize presenting opportunities. And one example of that is Getty Ngwenya, inventor of the hand sanitizer stand. Crises create gaps in the market, and to the youth of South Africa, be vigilant and alert to identify gaps you may be missing or overlooking. Sometimes the answer is staring you right in the face. Perhaps you were born for such a time as this, with the flexibility and adaptability needed to thrive under these circumstances. I believe no other generation is better fitted to the task than us. Nonetheless, between the dynamic work demands and unofficially mourning the sight of the world as we knew it and will never see it again, we may be trying too hard to move, and we are going in silence in the name of resilience without realizing the damage we may be causing to our psyche. And that's how we come to take a closer look at South Africa post COVID. As a nation, there is more than this virus that we are facing. The fight against gender-based violence continues. Trauma to women and children within households has not ended just because a guest has knocked, or rather, barged through the door. Therefore, people will be needing more psychological support to counsel and deal with the trauma of losing loved ones due to COVID or their own personal experience of living through COVID. People will also need counseling to heal from long-term exposure to threats and social issues arising from or exacerbated by lockdown conditions. And these conditions could be inequality, poverty, gender-based violence, and bearing the brunt of corrupt leadership. This further increases the burden on healthcare professionals to meet these needs, and that's what Sinalo was saying, that hospital staff as a whole, as a team, in collaboration are important. No one person can do it without the other. Like the Xhosa saying goes, izandla ziyagezana, umntu ngumuntu ngabantu. This is especially important as we anticipate the rise in mental health diagnoses as a result of exposure to triggers for a prolonged period of time. Triggers being abuse, stress, anxiety, or fear. The monotony and hopelessness that can lead to depression, which places a further burden on the health system. But also, organizations should do a better job at taking care of the mental health of their staff, especially when it can be proven that the main stresses are work-related. I also see opportunities for health. New uptake in students and workers in different sectors to meet the burden of disease, which will also be the solution to many people's unemployment problems. As a health professional myself, I see this as a chance to diversify using other methods of treatment, online therapy, being more rigorous in helping patients to be more self-sufficient, in possibly increasing resources and reducing contact time. There is also the opportunity to challenge the norm and do things differently, to be creative. As a matter of fact, there are opportunities for action on every level. Personally, I hope to see a proactive and honest South Africa. Proactive and not reactive, leading with integrity. And I hope to see it in all spheres, in both public and private sectors, on all levels of government, including efforts by community bodies and NGOs. The current climate sets the stew for the rise of new ideas, new thinkers, new doers. The question then becomes, will we rise to the occasion? Now, of course, I'm not oblivious to the fact that we may take a long time to get there. Considering our current financial situation, some skeptics may even say we won't get there at all. Checking the temperature in the room, South Africa is quite furious, feeling betrayed, and are quickly losing hope and patience. All within reason. For the very thing that was meant to secure and protect us has left us exposed. And who does it fall upon to cover our nakedness? In closing, James Baldwin once said, and I quote, All of us are living through some kind of turmoil, which endangers all of our relationships. This turmoil is historical and it is personal. The aims of a society are, and always must be, to inculcate in its people a certain level of security. End quote. And that should be the purpose of a lockdown, to ascertain security. But how many can speak confidently about their security in South Africa? How many have the confidence that we'll ride this wave, weather the storm, and exit on the other side in our right minds?
And there needs to be a very great strategy in plan that government has to actually resuscitate the country post this pandemic.
Thank you so much for joining us on this podcast and also for engaging with us if you already have. I trust you have found it enriching and that it sparked some critical conversations within yourself or between friends, colleagues, neighbors, and family. If you have not yet engaged with us, this conversation is not complete without your voice. So comment here below or give us a nudge on our other platforms. Let us know what you think. Until the next podcast, do all in your power to do, be, and become. Take care, South Africa.
Things I've learned and how perception of life has shifted. I've learned that if there's anything that you want to do it. Follow your dreams, because asbazi. I've learned that you can actually fly with the wings of an eagle if you want to, as long as you put your mind and heart into it.